Meningitis requires close contact to spread. About 1 in 10 people carry the bacteria without ever getting sick. Pinpoint rashes that become larger blotches suggest an emergency. But we need to catch it sooner. If you've seen the news this month about the Meningitis B clusters in Kent, UK, your first instinct as a parent is probably a mix of anxiety and it won't happen to us mindset. But here's the truth. You need to know what to look out for. Today, we're going to stack actions that could literally save a life. We'll look at why the vaccine gap matters, how this bacteria usually spreads through our homes, and the symptoms that look different on different skin tones. No fluff, just the facts every parent needs to know. I am Dr. Odi, and this is Little Actions. From pediatric health tips to mental health advocacy and support for Black and ethnic minority families. We're here to help you stack your little actions for a healthier future. Hit that subscribe button. Let's grow together. Now let's move on. What is meningitis? Before we go further, we need to understand what we are actually fighting. Meningitis is an inflammation of the lining around the brain and the spinal cord. Think of this brain lining like a protective security system for the nervous system. When a bacteria like Meningitis B gets into the bloodstream, they attack that lining. And because it's so close to the brain, it's a race against time. It can go from feeling a bit under the weather to a life-threatening situation in under 24 hours. Catching it early changes the outcome entirely, which is why we have to be vigilant. Now let's look at the 2026 context and why now. The 2026 outbreak is primarily the Meningitis B strain. Why the Men B vaccine is now routine for babies in the UK, there's a lost generation of children and teenagers born before 2015 who may not have had this specific jab. Now, action 1 for you. Check your NHS app. Don't guess. Or look for your child's red book right now. Look for Men B and Men ACWY. If you don't see them, your child might be unprotected. Call your GP for advice. This is your first little action start. Now let's look at the symptom audit. We've all been taught to look for the purple rash that doesn't fade under a glass. But by the time a rash appears, the infection is already advanced. This means that pinpoint rashes that become larger blotches suggest an emergency. But we need to catch it sooner. Symptoms of Men B may include headaches, neck stiffness, nausea and vomiting, body aches and drowsiness, and even seizures. Watch for cold hands and feet, even if they have a high fever. This is a massive red flag. Light sensitivity. If your child is squinting at the TV or phone, that is a neurologic sign. You need to see your doctor. You need to report to the emergency immediately. The skin check. On darker skin, the rash won't look purple or red initially. Now check the palms of the hands and the soles of the feet and the inside of the lower eyelid. If you see tiny pinprick spots that don't fade away, call 999 immediately. If you're finding this helpful so far, thank you for watching. Take a quick second to click that subscribe button. It's a small action that helps us keep providing this dedicated support for our families. I would love to have you stay for the rest of the video. Let's get back into it. How it spreads. Meningitis requires close contact to spread. It lives in the nose and throats of some individuals. Here's how the 2026 strain is moving. First, social sharing. This is a big one for teenagers. Sharing vapes, water bottles, lip balms, or even a quick bite from a friend's sandwich. Next is the home spread. Coughing or sneezing directly on someone. Now, the asymptomatic carrier. About 1 in 10 people carry the bacteria without ever getting sick. They just feel fine, but they can pass it into a vulnerable child or young person. Action 2 for you. No sharing rule. Give your kids their own labeled water bottle for school. It's a small boundary that breaks the chain. Now next, what to say to the hospital if you get there. Hospital A&Es are under pressure, we know that. If a doctor says it's just a viral infection, but your gut says otherwise, use these exact words. Say to them, I am concerned about meningitis and sepsis. Please, can we clinically rule that out before we leave? This isn't being difficult. It's you being an advocate. Especially in our Black communities, we sometimes hesitate to push back. I'm giving you permission to be the loudest voice in the room for your child's health. Parenting is just a series of little actions. Today, your actions are: check the vaccine records, set the no sharing rule at home, share this video with your school WhatsApp group or any parent you know. The more parents who know these subtle signs, the fewer families have to go through the unthinkable. We've got this. Stay safe, stay informed, and see you in the next.